Morning, Elevation Health friends and family. Just got done with my morning walk once again and got something on my mind that I want to share with you. I'm supposed to be doing some sort of focus on diabetes and blood sugar control with the workshop coming up, but I was in particular thinking about one patient that I've been taking care of for a while, and all of the aspects of her care and what went into it and what we helped her with and all. And it's diabetes is so time sensitive. It's a condition that people actually don't die from diabetes. They die from so many other things, like Alzheimer's disease, heart disease, um, cancer. There are so many other things we know that diabetes causes: loss of limbs, amputation, vision loss, neuropathy. But I'd say, half of everyone right now, at least half, 50% of the people are either diabetic or pre-diabetic. And if you stop and think about those people, your family members, friends, loved ones, it's not just the diabetes that they have. They're on once you become diabetic, you not only start taking medication for that, but you start taking other medications on top of that for the side effects of the diabetes condition and the side effects of those medications, and also other conditions with your blood pressure, your cholesterol, your blood sugar, and it just the list just goes on and on. And usually you look around, and at some point that person's health is just spiraling out of control, and they age it's just such a significantly faster pace. It's really, really sad. And then when you look at adding insult to injury, of course, the vast majority of diabetic patients that I take care of come in already taking insulin or metformin. And what many people don't know is that type 2 diabetics who take insulin die at more than twice the rate of those given non-insulin treatments. So significantly increases a diabetic's risk of cancer. And metformin's no bargain either. Really, both of those medications only treat the effect and they don't correct the cause. And, cancer is a metabolic condition. We talked about that last month. We had our cancer prevention workshop last month. And if you don't correct the cause, the source and the root of cancer, diabetes, you're really only, on borrowed time, so to speak. So, at the upcoming masterclass event, we're going to be talking about how to reverse type 2 diabetes. We've seen people do this in as little as a week. How to stabilize your blood sugar. It doesn't matter what your blood sugar level is, any blood sugar level at any age. How to improve your blood pressure, how to lose your fastest 15 pounds ever, how to have better energy than ever, preventing Alzheimer's disease, cancer, heart disease. Also, we're going to talk about the top 3 research proven blood sugar stabilizing supplements. So it's going to be an amazing, amazing workshop. This masterclass event really just encompasses so many different levels of an individual's health. But going back to what I opened with, as far as the patient that I was thinking of when I was on my walk this morning, her name was Marilyn. And Marilyn, she's no longer with us. So it's a bittersweet story. And there's really 2 points I want to make. My patient, Michelle, she's been under care probably 20 or 25 years. She receives the weekly emails that we send out talking about our upcoming events and things of that nature. And she received a flyer promoting our diabetes and blood sugar control workshop. She invited her friend, Michelle, Marilyn. Michelle's friend, Marilyn, has all types of health conditions, just full-blown type 2 diabetic, cancer patient on medication for blood pressure. Multiple medications, health in dire circumstances. So Michelle has a burden to help her friend Michelle, invites her to our masterclass event, the diabetes masterclass event. She sits in the front row. Marilyn comes up to me at the end of the class, thanks me, gives me a big hug. A couple of days later, she's in the office for an examination, a consultation, and I started her under care. And I started taking care of her. And she started applying all the concepts that, we discuss at the masterclass event. Long story short, she loses 23 pounds. She got off her insulin. She got her blood sugar under control and literally reversing her type 2 diabetic condition within a short few weeks. Really, it was transformational. And she wrote a testimonial. She did all kinds of things, telling her friends and really trying to just highlight how grateful she was to have the knowledge and the opportunity. Michelle is her friend who referred her in is a wonderful lady, a believer, and she knows that the Bible says, for lack of knowledge, people perish. And so one of the points I wanted to share with you with this story is, the first one is the sad point that I was thinking about this morning. Marilyn did really well under care. She reversed her diabetes, but at the same time, she'd been diabetic for decades. And the disease had taken such a toll on her body that it allowed cancer to get a foothold. And while she was reversing her diabetes, the cancer that was inside of her lungs, which she didn't know about, was just having a field day, and it was eating her up inside. So Marilyn continued under care. She continued to do well. She continued to come to the workshops until she was diagnosed with stage 4 lung cancer. I continued to take care of her for, probably another year or 18 months. And sadly, she passed away. She refused the chemotherapy. She refused the radiation. And that was a decision that her friends and everyone honored. And she died gracefully, and she died peacefully, and she died her way. And her friend Michelle, who brought her to us, who allowed her to have the last few years of her life as at least the best quality of life that she possibly could have had, was an amazing blessing. And Michelle, she was very giving. She gave of her knowledge. She gave of her time. She cared for Marilyn. She literally was a home healthcare aide that worked for nothing, really, and didn't expect anything. She just wanted to be a blessing to her and serve her and love her and give to her. And that was like the calling that she had on her life, to serve this lady as God would use her to do that all the way into the end, until Marilyn's last day. And I'll tell you what, it was a blessing watching that. It was a lesson for me, and something that I'll never forget. Interestingly enough, when Marilyn passed away, she left Michelle her house. And what an amazing blessing that was. And Michelle, she just recently, her and her husband just recently moved up north to be with their family. And, I have had the privilege and the honor over the last 30 plus years to take care of so many people like this, who've been so generous with their knowledge, their time, themselves, in sharing and serving and giving to their friends and family members and loved ones. In particular, bringing them to events like this. Because as I said, and I always say, for lack of knowledge, people perish. If 1 out of every 2 people that you know right now are either diabetic or pre-diabetic, and we know from all of the research showing today that people with running high A1C, high blood sugar, have a significant increase in cancer, literally doubling your risk of cancer. What more do we need to know to make sure that we can reach out, tap someone on the shoulder, grab someone by the hands, and ask them if they'd like to learn more? Ask them if they'd like to learn solutions that can give them a better life and better health. And that's what this workshop is all about. You never know how far reaching something that you'll think, say, or do can change or save the life of a loved one tomorrow. And so I want to encourage you to do that. This workshop, we just opened up registration. It's coming up in a couple of weeks, Tuesday, November 11th at 5:45. Our diabetes reversal and blood sugar control master class event. Please don't miss this one. Whatever you do, this is going to be our biggest and most powerful transformational workshop of the year. It's coming up here in a couple of weeks. Seating is limited. Call now to register yourself, family members, friends, loved ones, whoever it is. Seating is going to be limited, so please do that now. Thank you for joining me today. I love and appreciate you. God bless.